Thank you very much. What a moving presentation that was. I'm very glad to hear that actually we saw that much of the wars in the world are being waged in countries that are actually being essentially markets for the rich countries of the world, such as the ones in this part of the world that we're currently in today. And I'm really glad you brought that up, because the military-industrial complex that people have written about for decades now continues to rule the world. And I was interested when you talked about waging, etc., that the word profit didn't appear, but I think it was implicit in your remarks. Anyway, I'm going to talk about something completely different, although what I'm going to talk about has a very strong bearing on war and conflict, which affects very large sections of the world. But the subject that I've been asked to speak about is a subject very close to my heart, which is on the mental health of young people, which not surprisingly will be profoundly affected by war, but is affecting young people in all parts of the world, irrespective of conflict. Now, any conversation about the mental health of young people must, in my view anyway, begin with two very important scientific foundations. And those two foundations are shown on this slide. The first foundation is from the science of epidemiology, the study of the distribution of health problems. And in this foundation, I would like to highlight two key findings from this science. The first is that most mental health problems begin before the age of 24. What proportion? Roughly 75%. That is to say, 3 out of 4 adults who are affected by any mental health problem will have had that problem begin during adolescence or young adulthood. The second important finding is that no matter what kind of mental health problem you have, no matter how it appears to the clinician, all these different kinds of mental health problems share a common determinant. And that determinant is neglect and deprivation in the early years of life. Incredibly, child neglect predicts every known mental health problem on the planet. And then we have two other very important findings coming from the foundation of neuroscience. The first finding is that the brain is plastic. You heard about this yesterday. For those of you who are wondering what that means, no, it isn't made by Tupperware and it isn't disposable. It simply means that the brain is exquisitely responsive to the environment. It responds to the environment both anatomically and functionally right through early life. When I was a medical student, I was told that the brain somehow magically stopped developing around early childhood. Today we know that the brain continues to respond dynamically all the way into young adulthood. And for those of you who are past your adolescent years here, you'll be glad to know that it actually continues to respond even into old age. This is a dramatic new finding coming from neuroscience. And the second important finding is that the different parts of the brain do not all mature magically on the same day. And this is particularly important for adolescents. Why? Because the part of the brain that's very deeply embedded in our skull, the limbic system, that mediates our raw emotions, love, passion, anger, attraction, this part of the brain that drives our desire to seek thrills and take risks matures fully 5 to 6 years earlier than the front part of our brain, the prefrontal part, which acts as the brakes in adult life. Think back of those wonderful cartoons from our youth, and I'm talking about my youth, and I think many of you here too, when you used to have those cartoons in which you had the angel and the devil arguing with the cartoon adolescent character who is about to embark on something terribly thrilling, but also terribly risky, and you had these contradictory messages from the angel and from the devil, giving them different kinds of advice. Think back to that cartoon, and actually that cartoon very nicely represents that part of the brain, the prefrontal cortex, which makes you think about the consequences of your action. Now that part of the brain matures 5 to 6 years later than the limbic section of the brain. Therefore, it's not very surprising when you know that many of us would consider that Young people are passionate, irascible, and apt to be carried away by their impulses. Some of us here might think that this is in fact a condition of modern times, but as you can see from the author of this particular metaphor, this is of course a gentleman who is not quite a contemporary philosopher. What does this mean? Well, it means that young people, adolescents, are biologically and evolutionarily primed to take risks and seek thrills. It is normal when you're 15 years old to take a risk. Indeed, one could argue that if we did not take risks and seek thrills and learn from the consequences when you're 15 or 16 years old, you will be ill-prepared in your adulthood to learn how to deal with the kinds of challenges and questions that will be thrown at you. And in this way, teenagers of the human species are very similar to their counterparts across the animal kingdom. And no one knew this better than that master of the young mind, Walt Disney. All of you who have seen any Walt Disney movies will know that almost always at the center of every Disney film is an adolescent. May not be a human adolescent, but as you remember from this wonderful example, Finding Nemo, it could be an animal adolescent. This is, of course, the story of a young fish called Nemo. Think about that story. In this story, young Nemo decides to do something terribly risky. He decides to swim up to the surface of the sea from the depths of the ocean, in spite of, and maybe actually because of, his father's warning that he shouldn't go up to the surface of the sea. Why was that? Because his father warned him that if he did so, he would be in danger of being caught by the fisherman's net. Of course, that was exactly what Nemo needed to hear to actually go up to the surface of the sea, and he was, of course, promptly caught by a fisherman's net. You can actually see examples of this right through Disney's oeuvre, examples that show that he understood the young mind way before any of our scientists had begun to unpack it. So what? This means that developmentally, young people have one of the most unique phases of the human life course in terms of the advantages that their brain offers them to learn the necessary skills to be successful adults. Indeed, some people argue that this is the phase in life that you will learn the most important life skills of all, which is why life skills training is so well timed for this demographic. However, this very characteristic of the differential maturation of the brain and the plastic brain also means that young people are particularly vulnerable. And to understand those vulnerabilities, we have to look at the social worlds in which young people are growing in today. For it is in the social worlds of young people that we will begin to unpack the key understandings not only to their mental health problems, but indeed to all risk behaviors. Because one of the very interesting things about risk behaviors in young people, whether it is sexual risk-taking, whether it is indulging in violence, driving a car drunk, driving a bike without a motorcycle, having sex without a condom, no matter what kind of risk behavior you actually encounter, you will often find very, very similar factors that determine those risks. And what are those kinds of risks? Well, I think these are all very familiar to you. Child neglect, in my mind, deprivation through the early years of life in all its myriad forms, from just the so-called everyday emotional neglect to the more extreme forms of abuse. Parental mental illness and other forms of deprivation that often you will see in conditions of extreme poverty and hardship. The earlier onset of puberty. For example, in the last 30 years in the country that I work in India, the age of menarche has fallen by 4 years. This is the most dramatic fall in the age of menarche in millennia, and it's happened within 4 decades. And of course, a lot of that is due to the good reason that young girls are better nourished than they were before, but it also means that therefore the very important role of sex hormones on psychology and brain development is now occurring at a much earlier age. Violent experiences, and here I don't only mean violence in the everyday world, but also in the virtual world that many young people inhabit more and more. The use of unhealthy products that are very specifically targeted to young people. This is another kind of industrial complex, the complex of alcohol industries and a variety of other industries that are specifically targeting the young brain that we now know today is particularly vulnerable for all the reasons I mentioned earlier to the effects of addictive substances. And in the country that, again, I work in, rigid social norms. And by this, I mean the rigid social norms that society applies on young people who are seeking different ways of living their lives, particularly the right to choose who they love and the right to live the life that they wish to live. Some of you heard yesterday that suicide, for example, is the leading cause of death in young people in many parts of the world. It is, in fact, the leading cause of death in young Indians. And what is peculiar about suicide in India, as it was in the case of China, Vietnam, and many other transitional economies, is that it is commoner in the more educated young people. This is a complete opposite, of course, to the Western world. And when you unpack why is it that young women are killing themselves in astonishing numbers in India today, 3 times more than young women dying in maternal causes, it is often because of the denial of those young women's rights, for example, to live with the man of their choice or to pursue a career of their choice. And in that case, it also applies to young men. So the consequences are not surprising then. Yesterday we heard from Dr. Saxena that mental and substance use disorders and injuries, not just suicide, but also accidental injuries, many of which are actually predicated by mental health factors such as impulsivity and substance use, are the leading causes of death and disability in both genders and in all countries of the world, regardless of their socioeconomic status. It is true that in some sub-Saharan African countries, HIV continues to be the leading cause of death and disability, but in most other countries of the world, and especially as countries make the epidemiological and demographic transition, you will find that mental and substance use disorders are by far and away the leading causes of death and disability. So, we need to look beyond health as well. Mental health and substance use problems have profound implications way beyond health. They are one of the major reasons for poor educational attainment, which in turn mean poorer chances of economic inclusion. And this is one of the less well acknowledged pathways for the intergenerational transmission of poverty. Women who are living in conditions of poverty are more likely to have mental health problems. Because of those mental health problems, they are less able to take good care of their newborn children. That deprivation in childhood then transmits into poor cognitive abilities and mental health in the adolescent, who in turn does worse in their educational space, does worse in their adult life, and so on and so forth. This is also a major reason why young people are often in trouble with the law. If you encounter the nature of problems in juvenile offenders in any part of the world, you will find that conduct and substance use problems dominate. And finally, as we heard from the previous speakers, the increasing concern of young people who are disaffected, disengaged, disconnected, and despondent with the societies that they live in part influenced by poorer mental health, is also leading to alienation and attraction to radical ideas. So what can we do about this? On this slide, you can see a series of different interventions that are evidence-based and which can be delivered across different platforms from the disease control priorities work. At home, we know now that parenting interventions are extremely effective. Much of the evidence on parenting comes from the first 1,000 days of life. Yesterday, Zulfikar Bhutta asked a very important question about timing of interventions. I think that's a critical question. However, the tragedy is that we know far too little about parenting beyond the first 1,000 days. This is an important knowledge gap. What is the kind of parenting and what is the impact in middle childhood and young adolescence? In the community, we have very good evidence on interventions in schools to build life skills, particularly interventions that enable young people to learn the skills for emotional regulation. We need to work actively towards improving access to evidence-based psychological treatments. These are, by the way, amongst the most evidence-based clinical interventions available in any disease area, psychological therapies based on cognitive and behavioral principles. And the exciting thing about this evidence is that you don't need mental health professionals to deliver them. In fact, the evidence points to the effectiveness of guided self-care delivered either in a book form or in the form of a digital app for those who can access it, but equally in the form of frontline community health workers delivering these interventions. This is extremely exciting that you can deliver such proven interventions in the hands of low-cost and widely available human resources. We need to find ways of reducing access to methods of suicide. One of the reasons why we have such a high toll of suicides in young people in Asia is due to the very easy availability of pesticides. And of course, we need to look at how we can mobilize young people to combat some of the oppressive neighborhood factors such as violence, as well as building social capital. At the level of the larger societies that we all live in, we need to work with our governments to ensure progressive attitudes, to entitle young people to choose the lovers they want to live with and to choose the occupations they wish to pursue. We need to think about interventions that make sure that companies are not profiting on the health of our young people, for example, by marketing alcoholic beverages to underage drinkers. Ultimately, we need to think about joining up for adolescent well-being in 4 key ways. We need to integrate the ideas of working at the level of a population all the way through to individual. We need to have an interdisciplinary perspective, integrating neuroscience with social, clinical, and public health sciences. We need to think about delivery of interventions in a coordinated way across different platforms, and we always need to keep young people at the heart of all our planning and implementation. With this in mind, I wanted to just briefly share with you an initiative we launched in Delhi on April 7th, World Health Day. This is an initiative that we have enabled young people to design and run in partnership with Instagram. And it's really intended to get young people to start talking about mental health, primarily by using their own stories of experience of mental health problems and recovery and hope to do with mental health. And that they can actually share these stories in a variety of formats such as essays, poetry, photographs, and video. And when we launched this initiative in Delhi, we also launched a short animation video that really describes to young people why mental health is very important. And perhaps I'd like to just ask if we could show that video now.
मानसिक स्वास्थ्य क्या होता है? हम जब मानसिक स्वास्थ्य की बात करते हैं तो मन में तनाव या खुशी या गम जैसे फीलिंग्स आते हैं, या फिर डिप्रेशन और बाइपोलर डिसऑर्डर जैसे मेंटल इलनेसेस के बारे में हम सोचते हैं। हमारी जिंदगी में कई उतार चढ़ाव आते हैं और हम हर दिन नई प्रॉब्लम से जूझते हैं। प्रॉब्लम्स जैसे फ्रेंड्स हमारे कपड़ों का मजाक उड़ाते हैं, किस स्टाइल से बात करते हैं या कैसे चलते हैं। प्रॉब्लम्स जिनका हमें कोई अंदाजा नहीं होता, जैसे किसी फ्रेंड या फैमिली मेंबर की मृत्यु, कोई बुरा या मुश्किल ब्रेकअप या किसी बुरे अपमानजनक रिश्ते में उलझना, या एग्जाम्स या एंट्रेंस में फेल होना। हमारे बड़े होने के साथ साथ जो जिम्मेदारियां आती है उनसे जूझना। अच्छा मानसिक स्वास्थ्य या मेंटल हेल्थ हमें जिंदगी की इन छोटी और बड़ी प्रॉब्लम्स का सामना करने की ताकत देता है और फिर से जिंदगी में पूरी तरह से शामिल होने में हमारी हेल्प करता है। इसके बिना जिंदगी इतनी सुंदर और उज्जवल नहीं लगती। आज खराब मानसिक स्वास्थ्य युवाओं के अनहेल्दी होने का सबसे बड़ा कारण है। किसी से इस बारे में बातचीत करना मदद पाने का सबसे पहला स्टेप है, और जब अपने फ्रेंड या कोई फैमिली मेंबर को मदद की जरूरत हो तो उनकी बात संवेदनशीलता से सुननी चाहिए। कभी-कभी हम ऐसी फीलिंग से डरते हैं, शर्मिंदा होते हैं, लेकिन हमारा मानसिक स्वास्थ्य बहुत जरूरी है। चलो इस बारे में मिलकर बात करते हैं। आज तुम कैसे हो?
So what I want to say is that this entire video was prepared by people under the age of 21, the messaging, the design, the drawing, and the production. So I want to end by simply saying is that the adolescent brain, including I think most of our brains, are works in progress, but nevertheless more so true for adolescents than any other age group. And that cumulative factors operating across the life course, the first 20 years of life, not just the first 1 or 2 years of life, the first 20 years of life at the very least are profoundly important in understanding risk behaviors of all kinds, not just mental health, but also very specifically the emergence of mental health problems in this age group. And we already know the interventions that can mitigate and even reverse the effects of those risks. It is time for us to actually put into action those interventions. Thank you.